Colostomies and ileostomies. We're going to talk about the typical type of output that you're going to see in both of those ostomies. And we're also going to be talking about some dietary changes that we can suggest to our patient if they're having any problem with consistency or volume. The first one we're going to talk about is the ileostomy, which, as you all know, is a stoma created using the small intestine. So the output that you're going to see with an ileostomy is generally going to be liquidy or very, very soft. So first of all, we have our stoma here in the middle, and then around it we have the wafer. And we're going to take our bag and we attach to the wafer here. The best bag to use for an ileostomy would be a bag that has a spout at the bottom that just is much easier to drain the liquid than one of the roll-up bags. If you had a patient that had a really, really high volume of output and the bag was getting very heavy and full with liquid and it was kind of pulling on the wafer and it was maybe even creating some leaks there, another idea you could suggest would be to take your standard Foley catheter drainage bag and take it and attach it to the bottom of your spout, and that way the stool then drains down into this bag and you don't have to empty it as often, and it also relieves a lot of that weight on the wafer. So if you did have a patient that had a really high output with the ileostomy, you could suggest some dietary changes for them. You could come to this food reference chart here. You could come to the section called stoma obstructive, and you could suggest intake of apple peels, coconuts, dried fruit, mushrooms, nuts, anything on that column there. It's going to help kind of solidify the stool a little bit and decrease the volume somewhat. So those are some ideas for those patients. The next, we could talk about the colostomy, which the stoma is created using part of the large intestine. The output that you typically see there is going to be more of a solid formed stool. Again, this bag attaches the same way that the bag for the ileostomy attaches. The bottom of this bag has a roll feature with a Velcro closure, and then when you open it, it has a little bit of a larger spout at the bottom. So this would be appropriate for formed stool, and say you had a patient that was complaining of feeling distended or constipated with a really hard stool output. You might consider, again, referring to the chart, and this column here talks about constipation relief. You could suggest coffee, cooked fruits, cooked vegetables, fresh fruits and fresh fruit juices, increase intake of water. All of that is going to put a little bit more fluid back into the stool, soften it up a little bit, and relieve any sort of constipation, and just make the stool easier to empty. So, if anyone has any questions, I'd be happy to answer them.